Hello, welcome to another episode of STEM Mobile Lab presents Virtue Live 360 Tours. I am Chris Tolliver, the resource specialist for the School District of Osceola County and educator on the Osceola County's STEM Mobile Lab. Today in our behind the scenes tour, we are going to take a look at the pharmacy department at Advent Health Celebration Hospital. Now, due to the nature of this behind the scenes tour, we cannot continuously walk from location to location. We have to cut from place to place in order to protect patient confidentiality. We are going to be moving through some pretty sensitive areas. So I apologize if it's a little disorienting to jump from place to place, but I guarantee you'll still get a lot out of this. So thank you again for joining us. Please don't forget to hit the like and subscribe button so that you never miss another one of these tours. And in the description below, you will see a link that I want you to fill out. It is a survey. And once you complete the survey, you are entered into a chance to win a fantastic prize for you and your classroom provided by Advent Health Celebration. So with that behind us, let's go ahead and start the tour. Thank you for joining us.
Hi, welcome back. We're now at another area of the hospital here at Advent Health Celebration in the Clinical Services Department. And we are with two other members that work on the pharmacy team. And I'll introduce, this is Corey. Corey, will you tell us a little bit about yourself and how did you get to your role that you have here at Advent Health?
Yes, again, my name's Corey. So from high school, I went to do a undergraduate degree at Florida State. So I majored in chemistry, and then after I finished that degree, it led me on to doing pharmacy school. So I always loved the chemistry behind the drugs that we use. So it was kind of a natural transition over to pharmacy school for me. And then after finishing that, I ended up here at Advent Health Celebration to do my residency, and then stayed on after my residency working in the cardiovascular and neuro ICUs. So we take care of the sickest patients in the hospital, and we facilitate some of their medications with them and make sure that they're on the right medications to get them better and get them out of the hospital.
Do you always work in a room like this just full of computers?
So most often I'm actually up on the unit with the patients. So we stop down here to help teach the students that are under us as well as the residents that are training under us as well.
Okay, and so I guess the computers are a way to communicate so you can see patients' diagnoses. Doctors on the floor can actually send medications for you to review, and then you work together in that way.
Yes, exactly right. So the computers are a tool that help us. We love seeing the patients, but there's a lot of information that we got to review every single day. So it opens up a way to communicate with the doctors, the nurses, as well as all the specialists as well to make sure the patients are getting the best care possible.
You talked a little bit about that you majored in chemistry. Did your high school courses look a little differently? Did you take more sciences in high school?
Yes, exactly. In high school, I did take more sciences, took AP chemistry before in high school as well, but loved biology, chemistry, all of the sciences as well.
Great, thanks. And Trudy, can you tell us a little bit about your path and how did you get here at Advent Health?
Growing up, my mom was a microbiologist, and she always took me to the hospital with us. And instead of take your daughter work day, she would take me to the lab. And I've always liked the microbiology part of science. Science and math really just came easy to me growing up, something that I just found a calling to. I went to undergrad at UCF, go Knights, and I graduated with a bachelor's degree in molecular microbiology. And then that led me to pharmacy. I've always liked science, and then I went to pharmacy school in Palm Beach, Atlantic down south, and then I actually did rotations here at Celebration, and then ended up actually doing my residency here as well. I actually did it downstairs in the ambulatory care department downstairs, and I ended up really falling in love with the inpatient side, and now I'm here. They can't get rid of me because I just want to stay.
So my final question is, this would be to both of you. So that sounds like a lot of school, right? So someone coming into the field, it sounds like a lot of school. Did any of you do any other jobs while you were in school that supported what you were doing, or no? You just totally went to school the whole entire time?
I actually during undergrad, I was a phlebotomist, so I drew people's blood during undergrad, and then I actually worked at Publix during pharmacy school. So all science related.
Yep. And for me, I actually did quite a few different things going through school. So I actually worked for a movie theater and then a laser tag place after that too. So pretty much anything that was fun to do work as well, and then still let me focus on school.
Great. Well, thanks so much for telling us a little bit about yourselves and what your role here is today. And we're going to head up to another area of the pharmacy.
All right,
Perfect.
thank you.
Thank you.
Hi, welcome back. We are now in the inpatient central pharmacy here at Advent Health, and we have a couple of people I want to introduce you to. First, Jessica.
Hi everyone, my name is Jessica Yannett. I'm a fourth year pharmacy student attending UF College of Pharmacy.
Hi, I'm Sophia Baksh. I'm also a fourth year University of Florida College of Pharmacy student, and we're here on our hospital practice rotation.
Great. And Jessica, can you tell a little bit about how you got to be where you are right now as that fourth year resident?
Sure. So I actually started out with a biology degree for my undergraduate. So I did four years for my biology degree. At first, I didn't really know what I wanted to do with my biology degree. I actually thought that I wanted to be an environmental biologist. But when I was taking my classes, I was interested in like the anatomy, so how body works, and also chemistry, how drugs interact in your body. So that really interested me. So I thought maybe I should go into a medical field. And the pharmacy stuck out to me because it combined chemistry and anatomy, two things that I like. So after that, I applied to pharmacy school at UF, so that's a 4-year degree. And so we are currently in our 4th year. Our 4th year is comprised of just clinical rotations. So we go into different fields of pharmacy, like community pharmacy, hospital pharmacy, or ambulatory care. So right now we are in a hospital pharmacy rotation.
Great. And then when you were in high school, did you know that you wanted to go into healthcare, or you just love biology, and so you decided to major just in biology?
I did not know that I wanted to go into healthcare. So like I said, I was interested in like earth sciences. So I thought I wanted to be an environmentalist. I actually had a job where I was watching turtles, just like a turtle monitor. They would come into the harbor, and every time they were there, we would just monitor their patterns, like their breeding patterns or what they do when they come onto shore. So that was something that I did when I was in high school.
That's great. See, everybody's path that I think that we've met today has something different to share.
Definitely.
What about you, Sophia? Did you have a different path?
So I from high school I went to undergrad. I went to the University of South Florida. I did my bachelor's in biomedical sciences, and I did 2 minors in public health and biomedical physics. Upon graduating from undergrad, I became a teacher for a few years. I actually taught middle school math, 6th grade and 8th grade. From there, I got my master's degree, and then from my master's degree, I applied to pharmacy school.
Great. Well, that is very interesting.
Yes.
And so, I think it's just amazing how everybody's path has been so different. Can you tell a little bit specifically about what this area we are standing in? It seems like we have a lot of machines going on, all kinds of different medications here.
Yeah, so today we're going to show you the kit check machine. This is my favorite part of the pharmacy and my favorite machine. I just think it's really cool. When I first came into this rotation, this is my first time being introduced to this machine. So this machine here is just like one big scanner that can scan all medications, like over 1,000 medications all at once.
Wait, did you say over 1,000 medications?
Yes, we have scanned over 1,000 medications in
At
there.
one time.
At one time. And we do that so that we could register them quickly, so that they know what type of medication it is, what the strength is, and what the dose is. And so that goes all into this computer here, so that when we come up with these type of code card trays, these go in the hospital floors. They're just like quick drug trays where if someone ever has a heart attack, they could come here and try to resuscitate the patient with the medications on here.
So they're using it when they're calling a code blue.
A code blue,
Is that right? So
yes.
code, you hear that sound,
Yes,
code blue in
code
the
blue.
hospital.
Uh-huh.
Everybody kind of runs into a room,
Exactly.
and they're there to save the patient.
Yes.
And so they need their medicines
Quickly.
very quickly. So that's cool. So all these meds come into this kit, and then you know exactly what's going to be
Yes.
in there,
Mhm.
and then these are delivered to floors.
Yes. Yeah, so I would like to show you how we do that. So these medications in here all have a tag, a kit check tag. So like I said, when we put them in the system, we say what kind of medications it is. So now when we put this box in here, this box has a list of medications that have to be in it. So when we scan it, it should tell us what's in it, what's missing, what's going to expire.
Just takes a few minutes to scan.
So I get it. So you don't have to use a barcode scanner on every single med,
Yes.
which takes a lot of time, right? And you don't have that kind of time when you're serving so many
No.
patients at one time.
And we have to have a lot of these kits, card trays, like ready for any of the nurses who come down here and say, we need a code tray because we just used one. We need to replace it.
So those code trays are actually on the floor, but when there is a code and they use it, then they bring it back and we supply them with another one.
So even if they only use one medicine out of there,
That is
it
correct.
still has to come back
That's
here
correct.
to the pharmacy.
That's correct. And that's when we scan it, we know what's missing. The computer will actually tell us what's missing and how many of them. And it also tells us the medication that has the earliest expiration date, so we kind of keep an eye on that date as well.
Oh, so it's a constant, you need to have a lot of detail oriented for this job.
Yes.
And computer skills.
Yes.
So not only math and a love of science, but you have to have a lot of computer skills and
Yes.
be very detailed
I
oriented
would
to do
think
this
so.
job.
So for this example, do you want to kind of go
Yes.
through the medications?
So we have 3 missing medications here. So that's basically telling us here that we need atropine, calcium chloride, and epinephrine. And we already have them pre-tagged so that we don't have to go and pull them right now and tag them up. So we need epinephrine, atropine, and calcium chloride. So these here have the tags on them. We would just open this back up. We can put it on top. And then we re-scan it, and it'll tell us if we have the right products or not.
Okay, so I can hit scan again.
So that's great. So this reduces medical error. So if
It
you would
really
have
does.
if you would have pulled the wrong medicine
Yeah.
and put it in that card again in an emergency, they
Yes.
really need to make sure that the
Yes.
right med is in there.
Right.
So that's great. And then the computer will then tell us if you did your job right.
Yes.
Jessica.
It does save time, and it's also like it reinforces that safety for the patient comes first.
Right.
And it does take a little bit because it's scanning every single
Every
med that
med,
is in
yeah.
there.
Okay, great. So right here it says we have 0 extra, we have 0 missing, and 0 expired. And then the latest one that will expire is this medication, but that's not until a month
And
from now.
a month from now. So it is still safe to send to the floor.
Yes, correct.
Great. Thanks for showing us. I'm excited to see what's next. Should we move to right around the corner?
Sure.
Hi, so we're in another area of the pharmacy. And so this area of the pharmacy is called the sterile IV room. Is that correct, Marie?
Yes.
Okay, just wanted to make sure. And so this room is very highly specialized. The person who is in here had to have special training to do what he does. And so Marie's on the outside because we can't go in. So you're looking into the glass because this is a sterile environment, so we can't bring all of this equipment in here. So Marie, could you talk just a little bit about yourself and tell about maybe some of the things we're seeing in here?
Yes, hi, my name is Marie. I am the tech supervisor here at Celebration. I've been here for about 10 years now, and I guess we can move on to the IV room.
No, so tell me about how you got to are you a pharmacy tech?
Oh yes, I am a pharmacy tech. I actually work all shifts and do a little bit of everything in the pharmacy.
And so how did you get to be a pharmacy tech? Did you go to special school?
Yes, there is a 9-month program to do pharmacy tech school.
And where did you go to school?
I went to Anthem.
Okay, so 9 months and you were able to get to your pharmacy tech. You had to take a certification exam.
Yes, you had to take it's like an exit exam, and then you can also take a certification exam that's on top of it.
Great. Well, thanks. Would you mind explaining what we're seeing here?
Yes, this is our sterile IV room here, Everything that goes inside this room has to be sterilized and cleaned prior to going inside. We have our technician, Ken, that's in there. He is about to make some vancomycin. He'll be batching vancomycin. Everything that goes inside that hood has to be cleaned, wiped down, and all that good stuff.
So these medicines have to be sterile when given to the patient. So
Yes.
for him to be able to dose it correctly, and I see there's some IV bags there, right?
Yes.
So he's going to take the medicine out of the containers and then inject it into
Yes.
the IV bags?
Yes. So what he has right now is just basic normal saline. They're sterile normal saline bags, so once you tear it out of the bags, it's non-sterile anymore. But since we're opening it in a sterile environment,
You're reducing the risk of any microorganisms that may be
Exactly.
living there.
exactly. What's so cool about this room is that it gets deep cleaned every month. So we clean it from basically top to bottom. The ceilings, the vents, the floors, the walls, everything gets sterilized. The hoods get cleaned about 4 times a day, but the actual room gets deep cleaned with Paradox once a month.
And Paradox is a very specialized chemical to kill
Everything.
everything.
Everything. A little bit of everything.
Yes. So all those germs and possible viruses or bacteria that may have gotten in, double checking it at all.
Yes, for sure.
So did Ken have to do specialized training for what he's doing? I'm assuming he is a farm tech.
Yes, he is a farm tech. There is a special training to do IVs. In general, there's training, extensive training, and we also do a media field test as well. These media field tests are done every year,
Mhm.
and you have to pass it with no growth on your fingertip after you do the media field testing.
That's interesting. Wow. Didn't realize that they had to go through all that, but I guess that would be very important.
Yes, yes. Eventually, the test will be done twice a year, but now since it's COVID, of course, in lack of test plates and lab labor, we are doing it once a year.
Okay. Well, thanks so much for talking to us today. Really appreciate it.
You're welcome.
All right, well, let's head to the next area. I think we have one more step over here. Is that right?
Yes.
Okay. All right. Well, we're here now back again at Advent Health, and we're in the emergency department. We are here with Dr. Dan, and Dr. Dan is going to explain the role of the pharmacist, and how that pharmacist works with the other providers that are here in the emergency room, and the important parts of pharmacy that we need to be aware of. Dr. Dan, can you tell us a little bit about you?
So, like she had mentioned, my name's Dr. Dan, but I usually just go by Dan down here. I'm a pharmacist in the emergency department, and one of our major roles that we do here is to supply nursing staff with medications, give recommendations for alternatives or agents for medications that could potentially be more beneficial than what was previously ordered. We're also here to streamline therapy so that if they're waiting for medication, we're here to try to shorten that time frame. And we're also here just to help the staff in any way we possibly can.
Dr. Dan, how did you get to be in your role today?
So I got to this role today. Went to pharmacy school. It's a 4-year program. And I also did a 1-year residency, actually in this hospital itself, where I would rotate through the ICU, ED, outpatient clinics to kind of get a more broad of a spectrum for the pharmacy career.
So you, as a pharmacist, you have a medical license.
Yes, I have a doctorate in pharmacy. I actually got my undergraduate in chemistry, but you don't need to have that. You just need some sort of science background or have a strong understanding in the sciences to facilitate in earning this degree.
So let me make sure you understand. So you partner with the doctor to discuss medications
Mhm.
for that particular patient, and will make recommendations based off of what the doctor may have ordered. And the doctor may look at your advice and then make adjustments as would be best for the patient.
Correct. So our main job is to be a second set of eyes for the physician. So if the physician orders something and I agree with it, sure, yeah, it goes through. If the physician orders something and I agree with the direction they're going, but I think a different medication may benefit better due to XYZ reason, or if I say, hey, hold up, this is something we need to stop, because of this other reason, maybe we should hold off and try something else. So I'm really just there as a double check, and like I said, to be a second set of eyes.
Yeah, that extra safety for the patient is
Mhm.
very important. Can you tell me a little bit what's behind us? What are we seeing? What are these
Yes.
equipment?
So this is a automated medication cabinet. We call it a Pyxis because that is the brand that we use. You might see other units in the hospitals called different things. This one's just called a Pyxis. So we have a little computer over here where they can log in, sign in, and each of these shelves through here has a drawer that pulls out and then has a bunch of medication in little pockets. We also have the same thing in these tall drawers for a lot larger medications, such as your big bags of fluids, different vials, different drips. Would you like me to show you what the inside of one of these guys look like?
That'd be great. Thank you.
Yeah. Can you just log in real quick? And I'm just going to do a quick search for a medication that everyone I'm sure is very well familiar with, Tylenol. So, as you see, when I click on the Tylenol, the drawer popped open, and then you'll see the drawer with the exact medication opens up, and the medication is in here. What this is doing is basically saying that you can only get the medication that you were looking for, which reduces medication error and can also help to keep adequate stock within the pharmacy so that we do not run out of medications and we can keep an accurate inventory. That way, the nursing staff here, the physicians, aren't trying to look for a medication and scramble around trying to find it. And it overall helps with improved patient safety.
Yeah, and it's great. And it's pretty efficient. Imagining the large volumes that can come into the emergency room.
Oh yeah.
So I have one more question, Dr. Dan,
Sure.
and that is, are there pharmacists on other floors of the hospital, or primarily here in the ED?
So there are pharmacists in many roles within the hospital. I just happen to be one of the roles within the emergency department, but you have pharmacists in ICU department, you have internal medicine floors, you have pharmacists working in central supply, you have pharmacists working in infectious disease, with taking care of people who are sick with infections. You have chemotherapy pharmacists. You have a whole range of people that can be in hospital. It's really just dependent on what the hospital provides in terms of care. So if there's a type of care that the hospital provides that includes medication, you can guarantee that there is pharmacist involvement within that process.
Thanks so much, Dr. Dan, for being with us today, explaining those roles, and we really appreciate it.
Glad to help. Thank you.
So we're back. We just wanted to show you all how we compound a medication. And what compounding means is simply preparing that medication to its final product to be able to deliver it to the floor. So today we're actually going to compound azithromycin, which is an antibiotic medication. So we're going to go ahead and show you how we clean the area first and how we prepare the medication. So stick with us.
Okay, so yeah, I have a quick question though. That's a common medicine that I've heard a lot. Where would we be using that? What would a typical patient use that for?
So, like bacterial infections, like if you have a strep throat or a middle ear infection, usually they prescribe azithromycin. Sometimes it does come in tablet form, but some patients can't swallow a pill or they have a hard time swallowing. So we want to give it to them in liquid form, and that's why we're compounding this from a powder form into a liquid form.
Oh, so you're actually changing the medication
Yes.
so it's easier for the patient to take. In a
Yes.
sense. Okay, got it.
And sometimes we're also flavored, so it makes it good for pediatric patients too. If we have to batch
Yes.
one for a child.
Even
Yes.
for an adult patient.
Mhm.
Yes,
Just
that's
like-
right.
Yes.
Go. Okay.
Okay, so Jessica, so what are you gonna do? You said something about cleaning.
Yeah, so just to begin with, we want to put gloves on because we don't want to be touching the syringes or the product itself with our bare hands. So you want to wash your hands, dry them off, and wear gloves. And then next, we're going to go ahead and just clean the general area. This is our compounding area. So we just take the napkins. We have alcohol here. So we wipe that. Just want to clean the area. And then, like I said, this is ethyl alcohol. It's like hand sanitizer. You can also directly put it on your gloves. Sanitize. Okay, so now we're ready to compound, and Sophia will lead us through that.
All right. So first, we're just going to start by opening up the box, and inside we have the antibiotic medication in powder form. So if you look at the side of the directions, it will say add 15 milliliters of water to the bottle. So we have our sterile water right here, and we have our graduated cylinder right here, and we're going to add 15 milliliters.
Something I wanted to point out with this medication, go ahead, is that if you can see here, it starts out as a white powder, but after we add the water, something happens, and I'll let you guys see that.
So there's gonna be some chemical change that's happening.
Yes.
And what did you say that the measurement was?
15 milliliters.
15 milliliters.
Yes, of sterile water.
Right, and I was going to ask you that the other time too, because I think it's important that there's a lot of math involved in pharmacy.
Yes, yes. So even in some of our courses, we're required to do calculations, specifically for renal adjustments. For example, if someone's kidneys are damaged, we would adjust the medication dose based on the renal function. If it's a pediatric patient, there's different doses for kids and for adults. When you're mixing medications, as a perfect example, we have to measure out those liquids to be added to the medication.
Is that why they always are very important about getting weights with medication? Like you have to always know about like how much someone weighs.
Right. So if those drugs are weight-based dosed, meaning that the dose is dependent upon how much that patient weighs, and that's important to know. Usually that's in kilograms.
And then I guess accuracy too, right?
Yes.
So I mean, I saw how you poured that out. You were very specific about the amount.
Yes.
This is
yes.
not like baking a cake at
No.
home, right? So
I think baking has to be a little bit specific too.
well, I think so too. But you know,
Yeah.
in regards to medicine, whether my cake tastes good or not, right?
Right, yes, right. So it's very important to be specific with the dose, otherwise it could be ineffective, and that's obviously not good.
So like the standard for this one, the direction was 15 milliliters of water. So to do that, if you add that on here, it'll give you that strength that this is telling you. So it'll be 200 milligrams per milliliter. If you do too little or too much, then you're not having this strength of the drug that you're giving to the patient.
Oh, so basically you would water it down.
Yeah,
And
you
then
would
the
water it down.
And then the
Yes.
effect of the dosage wouldn't be
Will
right.
not be
That's
effective.
correct.
Or if it's too concentrated, then you're giving someone too much of the medication.
Oh, that would be
So
very
For
dangerous
either
as
an
well.
overdose or an underdose.
Got it. Okay, so what happens next?
Do you want to go ahead and get to that? Would you do packet first? And we just shake it.
This is just to loosen the powder.
Okay. All right. So we're just gonna pour the water in. So we screw the top back on. We just give it a good shake. Notice we have a color change.
So it was a white powder before, and then we added water, and now it's pink.
Now, would this job be the job of a pharmacy technician or the pharmacist or both?
Both.
It's
Yeah.
both.
Mhm.
I would say it's both. I think
Yeah.
it's more so the techs that are probably involved with the compounding side, but
Mhm.
for sure, a pharmacist can do that as
If
well.
if all the
If they're
technicians are
available.
tied up and the medication has to go up, a pharmacist can do it.
So I noticed you have some syringes over there. How do they play a part?
Yes. So this is how we're gonna drop the medication to these syringes, and so the typical dose here is 200 milligrams per 5 milliliters. So we're gonna do 5 milliliter syringes.
Okay.
Okay, so let's just shake this up some more.
So if a nurse ordered something for a patient, a pediatric patient, let's say, would you fill it in the syringes first before sending it and label it that way?
Yes, that reduces error because we're the ones preparing the medication. We're making sure it's the 200 milligrams per 5 mils because there's no saying that the nurse might pull something different. It's a common mistake. And before it even goes up to the nurse, these syringes are checked by the pharmacist. They check if this is the right medication, that this is labeled, it's the right amount of volume. So they need to double check all of that before it goes to the patient.
And sometimes if it's a common medication that we would have to compound often, we might do that ahead of time and just have it in stock so that way when it's ordered, it's already ready to be sent out.
So when the nurse gets it up on the floor, she's checking the order to make sure it's the right patient and checking to make sure that it matches on the label
Yes,
in
that's
which
correct.
was dosed. Okay, got it. So how do you actually put it in there?
Yeah, sure. So we actually just put a stopper in there. So it kind of sits very flush with the
It's like an adapter.
mouth of the bottle. And then we just put the syringe, so it just fits right in there like that. I don't know if you can see that. I'm just going to pull out 5 milliliters.
I can see how you're pushing the plunger back in and out. Is that to put air in there?
Not necessarily for this medication. Some medications you'd want to create that pressure. For this one, I just had a bubble, so I needed to push it back out.
Oh, okay.
And these are the little stoppers that we put on it just to cap it. And then we just hear that click, and then it's ready to go. Once we put the label on it for the patient, it's ready to go.
Now, if you weren't going to use that medication right away, does it have to be stored in a certain place?
So every medication is going to be a bit different. Some require it to be refrigerated, some don't. And then depending on the beyond use date or the expiration date, we can only hold it for a certain amount of time.
Yes. So this one it just says protect from freezing. So we actually don't refrigerate this one. We just keep it on the shelves. And then after you mix it, it says that it only has a shelf life of 10 days. So we would indicate that on the label that we print on here. We put the name, the dose, the date we made it, and the date it's going to expire.
Great. Well, this has been a fascinating tour. I think we've gotten a lot of aspects and learned a lot about pharmacy, all the different rules, and we really appreciate your time. We also want to remind everyone that in order to have be able to participate in this, and you want to have prizes for your classroom, look at the link down below and fill out the survey. So as many students who can fill out the survey, that's more chances for your classroom to win prizes presented by Advent Health. Are we ready to sign off, Chris?
We are.
All right. Well, thanks so much. Thanks,
Thank you.
Chris, for all this great technology. And thanks for the Education Foundation for help supporting this, our Virtue Live with the Mobile STEM Lab.
And don't forget to hit like and subscribe so that you never miss another exciting behind-the-scenes tour of a great STEM and CTE career. See you around.